If you or someone you know is experiencing rotator cuff pain, Intermountain Healthcare, the sponsors of this next segment, are here to help through exercises and sports medicine. Here's how.
My name is Dr. Brian Davis, and we are here at Intermountain Healthcare. We are in the Sunset, our beautiful office over here at Southern Hills Hospital. I am a physical medicine and rehabilitation specialist. My job is to work with folks for non-surgical needs of their joint issues. And so as we get older, the likelihood of us developing rotator cuff issues goes up dramatically. When we're younger, our rotator cuff functions better. Unfortunately, over time, as we continue to use our shoulders in ways that are different than our four-legged cousins, we end up putting greater demands on those rotator cuffs. Over time, what happens is that the cuff begins to fail. There's less flexibility within the tendon. The tendon has loss of its normal blood flow, which doesn't allow for proper healing, and we end up going down this cascade of pain and dysfunction and tendon damage that unfortunately can lead to the point where an individual may not be able to reach overhead. Rotator cuff disease can affect younger individuals, but in those circumstances, it's usually because of overuse injuries. They might have played a sport like a racket sport or a throwing sport, and that may have set them up to have rotator cuff issues. And still, again, those don't tend to happen until our 30s and our 40s and beyond, but as we get into our 50s and 60s and beyond, that's where we are much more likely to develop those rotator cuff issues that are going to be much more problematic and plaguing for us. The most important thing from the perspective of a clinician like myself is, first of all, to try to prevent these from happening in the first place, which means that you have to have the proper exercise program, you have to have the proper training or trainer to help you, or you have to just be able to evaluate your own fitness and make certain that you're doing the right exercises that are going to help maintain your posture, help maintain your fitness and your general strength and flexibility. So one of the most important things that we'll use in our instruction for our patients is something as simple as using a rubber band. And what's nice about these, you can stick them in between a door or have somebody hold them for you, and they create the resistance so that you can work on muscle strength. Another thing that I actually used throughout the course of this last 12 to 18 months during the pandemic are bands to work on strength and other fitness, working on your postural muscles. You can use it to stick it over a door, you can stick it under the door, next to it, and then you can create that resistance that you're looking for. And as we move into that older age group, hopefully we age in gracefully, but if we develop a rotator cuff issue, that's where someone like myself would step in and say, all right, here's what we need to do in terms of the exercise protocols, here's how we have to work on your posture, and here's what we're going to do to try to rehab this so we don't have to go down that surgical pathway.
Thank you, Intermountain Healthcare, for sponsoring this segment. For more information, just head to intermountainhealthcare.org/